Welcome to CHI Health Creighton University Medical Center, Bergan, Mercy, an academic medical center in Omaha, Nebraska, where you'll find a pharmacy department that is respected, supportive, and dedicated to the professional growth of our PGY1 pharmacy residents.
The strengths of our residency program are that our residents can really pursue a lot of different job opportunities when they finish their PGY1 year. So for example, if they want to pursue a PGY2 in a specialty area, we have a lot of specialty rotations that they can take that would prepare them well, and we have a really good match rate. We have a lot of residents that also want to pursue doing hospital-based jobs, and so your staffing component will really help you to get to that point. We also have residents that want to pursue academia and work in a pharmacy school setting, and so your teaching component, teaching certificate, precepting will really get you there. But our residency program will help the residents focus on what their goals and objectives are and really tailor the program to what their needs are and get them to where they want to be.
As a PGY1 pharmacy resident at CUMC Bergan Mercy, you'll experience challenging rotations and interdisciplinary rounds where evidence-based medicine is practiced and pharmacy input is valued. And you'll find a culture where our focus on training and education offers a unique and beneficial experience for the PGY1 pharmacy resident. We're a teaching hospital and proud of it.
We have a very active role with the medical team. Our pharmacy residents are fully integrated into the medical decision making on patient care during rounds in the mornings, so they're able to make prospective recommendations to the physicians. They have great working relationships with the physicians, and oftentimes even post-residency have working relationships with medical residents that they met here. We want to focus on doing what we can to make our residents feel like they maximize their learning opportunities in our program and are setting themselves up for success at the end.
Before we launch into a tour, remember to visit our website, chihealth.com, and our pharmacy residency program page. Here, you'll find detailed information about our PGY1 pharmacy residency. The schedule consists of 12 one-month rotations, including required clinical and longitudinal rotations. Required and elective rotations are available in many areas of specialization to offer experience in the provision of direct patient care. Residents will select a minimum of 2 selective required rotations. If the resident desires more than 2 rotations from this section, then those will be counted as elective rotation months. All right, let's show you around. First and foremost, we'd like to give you a glimpse into our 24/7 pharmacy department. Here, our pharmacists and residents provide medication preparation, dispensing, and delivery to our entire 400-bed hospital. As a pharmacy resident, you'll work in both the inpatient pharmacy and decentralized on the patient care floors, so you can get a mix of both aspects of hospital pharmacy. Down the hall, only a few steps away from the main pharmacy, you'll find the pharmacy resident office, where our 6 PGY1 residents spend a lot of their time. Each resident is provided with a workspace that includes your work laptop, desktop computer screen, and keyboard. You'll also have access to online resources through both the hospital and Creighton University Health Sciences Library to help with patient care and required projects. The residents really enjoy their time bonding in the office, bouncing ideas off each other while pre-rounding in the mornings or working on projects in the afternoons.
Having 6 residents is really awesome because you have people to lean on, and you have people who are also in the same position as you, who are new pharmacists and still learning and still growing their practice. And so we're bouncing off of each other, learning from each other, and also just leaning on each other.
Now that we've shown you our pharmacy department and resident office, we've circled back to the main hospital entrance. It's important to mention, right here in our lobby is one of our residences, and really all hospital staff, favorite places, our Healing Grounds coffee shop. It's a safe bet you'll be purchasing many cups of coffee, breakfast treats, and lunch soups and sandwiches right here over the course of your residency year. Down the hall from the coffee shop is our 38-bed emergency department. This is a level 1 trauma center with 5 trauma bays and 4 ambulance bays, and our pharmacy department has clinically trained emergency department pharmacists dedicated to staffing this area. Our pharmacy residents have the opportunity to take an emergency department elective rotation with our BCCCP preceptor, Dr. Ashley Austin. It's a unique experience unlike any other pharmacy rotation in the hospital.
I work directly in the ER. I go to traumas I go to code responses throughout the entire hospital, pretty much. Stroke activations. I help take care of people who are septic, in septic shock. For instance, I'll be in a code situation where we don't have a pulse. We've been doing all the things we can think of, or all the things the physician can think of, and then the physician turns to me and says, "What do you want to do?" And it's like I'm working at the top of my license. I'm making decisions with a physician that a lot of pharmacists don't get the opportunity to do. I prefer that the residents have the ability to learn hands-on, not just from watching what I'm doing. I have the residents for the first week. I am there to help them, obviously, and show them how I do things, and then after that I expect them to do things on their own, and I'm there to help them and make sure that they don't fail, but I let them learn by doing their own dosing for antibiotics, making their own recommendations. We talk about things so that way the resident's comfortable before they do that, but I let them learn on their own.
The emergency rotation, you get a lot of exposure to things like traumas and other medical emergencies, including things like cardiac arrest, intubations. The pharmacist and you as the resident are at the bedside for all of those types of things, and then you're at the bedside for traumas, and you really get kind of experience and hands-on training in terms of quickly treating those types of patients.
We're here now in our medical surgical ICU. As an academic medical center and largest hospital in our regional health system, we get a lot of referrals from other facilities for higher level of care with critically ill patients requiring ECMO, CRRT, and other life-saving measures that can only be provided here. Our medical surgical ICU has 2 wings with a total of 34 beds. We staff and provide critical care clinical pharmacy services for our patients 24 hours a day, 7 days a week. Our residents also have the opportunity to take a selective, required academic critical care rotation with our faculty preceptor, Dr. Mark Malesker, who rounds with our critical care pulmonary team that includes the ICU attending, ICU fellow, ICU medical residents, medical students, and oftentimes P4 pharmacy students. This large team provides a teaching focus with pharmacy integrated into the decision-making process.
My role with the ICU team is one of education. We review evidence-based decision-making for medication treatments, medication monitoring, review drug interactions. The pharmacy resident who is with me can actually help the residents, the medical residents, actually process orders and make sure orders are correctly put into our electronic medical record. They also can monitor medications like vancomycin, TPN monitoring, and warfarin dosing. I think the overall message about being a pharmacist in the ICU is one person can make a difference, and you are a part of a big team, and that team is, has to work together for the effective management of the patients.
CUMC Bergan Mercy is one of only 2 Level 1 trauma centers in the entire state of Nebraska. We have the capability to take care of the highest level of traumas, gunshot wounds, car accidents, and brain injuries, among many others. Our pharmacy residents can take an elective rotation on trauma critical care with our pharmacy faculty preceptor, Dr. Stacy Dull. She specializes in the unique disease states associated with critical care trauma patients in our 18-bed dedicated trauma ICU. During this rotation, you'll round with our board-certified trauma surgeons, trauma surgery residents, medical students, advanced practice clinicians, and potentially P4 pharmacy students.
With a Level 1 Trauma Center, you never know what's coming to you. It's a new day, every day, and when those trauma activations come in, you have no idea what to expect. So each day we're learning, we're treating different injuries, we're experiencing different disease states, new medications, using medications in different ways. Even though they may have had a critical care rotation, that critical care rotation doesn't necessarily deal with trauma or surgical patients. So when they come into my elective trauma critical care rotation as a pharmacy resident, a lot of what they're experiencing is brand new for them. So it's definitely a challenge. The learning curve is high, and not only a challenge from the information that they're learning, but also in terms of the team that they work with. My goal for a resident when they enter our program is that they're able to grow their knowledge base, hone their clinical skills, develop their critical thinking skills, work on precepting with pharmacy students so that they can go out and continue to educate and mentor future pharmacists, and that they really just get an overall great experience here. Just be prepared to practice at the peak of their degree.
Outside of our third-floor ICU units, we have plenty of other patient care units throughout the main hospital, including med-surg, cardiac care, and our dedicated oncology unit with its satellite oncology pharmacy. Our pharmacy department staffs each of these floors, 4th, 5th, and 6th, during the week. As you proceed through our residency here, you'll have a variety of rotations with interdisciplinary academic medical teams. All have a devoted team room where they meet prior to rounds to discuss patients, provide educational in-services, and generally congregate outside of patient care units. Pharmacy plays an active role in the discussion and can provide recommendations to the medical team that can impact patient care daily.
And we'll go through each patient, talk about what their problems are, how to get them better, ready to be discharged. If there's any issues with drug therapy, I'll bring it up at that time, or my resident will, or the students will, and we'll discuss it. And then when all those patients we've gone through all those patients, we'll go out and see them in the room. You also have an academic medical center. That's not very common. There's only about 20 in the whole country. You're going to get exposure to physicians who appreciate the pharmacy department, for one. I will tell you, when I don't have a resident or when I don't have a student, I hear about it from my physicians, that they want students, they want residents present. As soon as you walk around, you realize it. You see teams of 4 or 5, 6 people on them, pharmacy student, medical student, a couple of residents and attending, and a pharmacy preceptor. You're not going to get that in a lot of different facilities. The expertise of a pharmacist is medications, is how they're delivered, how they're formulated, what are their side effects, dosages, its indications, etc. That's what I want them to take away, that they have to be an expert in medication therapy.
In addition to caring for our surgical, trauma, or routine medical patients, we have a large women's health mother-baby focus with the busiest birth center within CHI Health. Our residents can take an elective rotation in our Level 3 neonatal intensive care unit, where they're exposed to a unique patient population, the smallest of our patients requiring the highest level of care. While patient care is the largest component of your residency, you'll also have to focus on a variety of projects and presentations throughout the year. With comprehensive guidance from a preceptor, our residents are required to present 2 formal pharmacy grand rounds presentations, one in the fall, one in the spring, to gain experience in this area. One of the biggest areas for growth as a resident, these are ACPE accredited presentations coordinated through Creighton University. Lastly, an area we really feel is not only vital to growth as a pharmacist and resident, but something that is unique to our program is the large focus on teaching and our close working relationship with Creighton University School of Pharmacy. As the primary practice site for Creighton University Health Sciences programs, our pharmacy residents interact with P4 pharmacy students on many of their rotations, which gives them the opportunity to precept and develop their precepting skills. Not only do residents work with pharmacy students on rotations, but they also are required to help teach pharmacotherapeutic case studies with P2 and P3 students at Creighton University. This unique opportunity for the residents includes preparing a comprehensive case in advance, once in the fall and once in the spring with a faculty preceptor, and then helping present and teach the day that case is presented during case studies. The resident will get to lead the discussion, ask questions of the student, facilitate the learning for all students in attendance, and then grade the students on their case presentation skills. In addition, other opportunities for teaching in the classroom setting exist at Creighton University and can be coordinated if interested, although not required. While practical exposure to precepting on rotations and classroom exposure to teaching is beneficial, we also provide the opportunity for our residents to take the Teaching Certificate course offered through Creighton University if they so choose, which is available to all residents in the state of Nebraska. This course allows our residents to gain even further knowledge into the art of educating our future pharmacists while learning what their teaching style is. All of these experiences combined really prepare our residents well for the possibility of pursuing an academic route post-residency, or the confidence to be a preceptor when the time in their career comes. We know the decision to pursue a residency and determining what program is the right fit for you can be challenging.
This residency program offers a lot of different rotations, and for someone who has a lot of different interests, especially like me, it's very cool to get to explore all of those different interests with different elective rotations, and also just with different opportunities that this institution and this program offer. This whole residency experience has really broadened my idea of what I want to do as a pharmacist, and also gives me a lot more opportunity in the career world when I get done with residency.
I feel very at home here. Between just the facility itself, I really enjoy the teams that I get to work on, the variety of teams. I feel since it is an academic teaching hospital, you feel very included, and a lot of the doctors ask you stuff. The residents definitely ask you things and lean on you for your recommendations a lot. So I feel like it's very pharmacy forward, and we're included a lot in actual patient care.
This program is really allowing me to become the pharmacist I want to be because it is a really well-rounded program. I think that the rotations that are offered, there's a lot of variety, both within the required rotations and as well as the elective and longitudinal rotations. I think the preceptors and other educators within the program all have different interests and come from different backgrounds, so there's a lot of information all being brought to the table.
I think the combination of being an academic medical center while still kind of retaining that feeling of being a smaller, more community-based hospital is really the strength of this residency, because I think a lot of people ignore or don't think about things like interdepartmental relationships and how important they are to not only kind of workflow, but how important they are to kind of your growth as a resident.
Because we're at an academic medical center, they're willing to teach you everything you know, but also they're willing to challenge you. So there will be circumstances where you're going to have to think on your feet and be able to utilize what you've learned from school, but also they'll be able to help you walk through everything if you need that kind of help. The workload, all the research projects that you have, the meetings that you have to attend, the staffing component, everything can be challenging. You just have to learn how to manage your time.
The culture at this hospital it's a great environment. I really enjoy working here. So I think they respect our opinions as much as we respect their opinions. You can certainly walk down the hallway and say hi to anyone that you come across. I think everyone kind of knows everyone a little bit. And so it's a good mix of camaraderie.
Thank you so much for your interest in the PGY1 Pharmacy Residency Program at CUMC Bergan Mercy. Remember to check out chihealth.com and our Pharmacy Residency Program page for detailed information. We hope we were able to give you a glimpse into what makes our program successful, and when it comes time to make your final application decision, that you consider CHI Health Creighton University Medical Center, Bergan Mercy.